Hello, I'm Miyeon Jung from IU School of Nursing. Today, I'm going to talk about my NIA-funded Case 76 project, which is a virtual reality and computerized cognitive intervention for MCI and heart failure. So we know heart failure is prevalent, affecting over 6 million Americans, and 23 to 50% of the patients experience cognitive impairment. And there are different etiologies, including cerebral hypoperfusion and microembolies, and these results in brain functional and structural changes. So my program of research focuses on developing and testing non-pharmacological cognitive interventions for people living with heart failure. To tackle cognitive impairment in heart failure, I tested a nature intervention using a laptop computer screen. This intervention is based on the attention restoration theory that posits that attention can be restored when it is not used, and nature is one of the best sources that we can make our attention rested. I think everyone has the experience feeling refreshed while looking out the window after long and hard work. So it's similar. The intervention was efficacious in improving cognitive function among 40 patients with heart failure, but the effect sizes were so small. To improve the effect sizes, I chose your virtual reality headset as the intervention platform that provides 3D environment compared to the computer screen, which is 2D. In our feasibility study among 10 patients with heart failure, we found significantly bigger effect sizes of virtual reality-based nature intervention to the computer-based nature intervention. Then, with the support from the American Heart Association, I developed a full nature intervention using virtual reality and active control condition using urban and built environments such as indoor gym, as you can see on the screen. We enrolled 74 patients during COVID-19 and just completed the study this summer. Based on our preliminary analysis, we found viewing 3D nature pictures 10 minutes per day, 5 days per week for 4 weeks significantly improved on these tests compared to the urban VR at immediate post-intervention. In addition to this line of restoration interventions, I co-investigated on studies testing cognitive training that targets neuroplasticity in the brain. Our team conducted a 3-group RCT to test brain HQ efficacy on improving memory and serum BDNF compared with the actual control condition, which is a computerized puzzles, and the usual care without any intervention. Patients were asked to do the assigned activities for 1 hour per day, 5 days per week for 8 weeks for a total of 40 hours. During the time, our 3 group received weekly phone calls from our research assistants who are nurses. Unfortunately, we did not find significant group by time interactions, and there were no moderating effects of APOE carrier status or baseline depressive symptom levels. However, we found that all 3 groups improved memory, working memory, IADL, and health-related quality of life, which is not usual in this very sick population. In addition, we found cost saving of the 8 weeks brain HQ over 8 months of follow-up. Patients in brain HQ group had fewer emergency department visit by 22% compared to the usual group. So our team thinks this tells some of the brain HQ effects, but we need to do something differently. Based on our innovation adherence data here in this table, many of the patients did not or could not follow the daily 1-hour training prescription. So I combined the cognitive restoration intervention with the training, hoping that the patients can focus more during the training and maximize the benefits from the training. To test the synergistic effects of cognitive restoration and training, we will test now called VITAR intervention, which is viewing nature pictures 2 to 3 days per week for 8 weeks, in addition to the CALM intervention, which is a computerized cognitive training using an iPad for the same frequency in a 2x2 factorial design. We will recruit 172 older adults with both heart failure and MCI, starting from March next year, and we will evaluate APOE genotypes and plasma tau levels in relation to the innovation responsiveness. So if you have any questions or would like to discuss potential collaborations, please email me, and thank you very much.